Ladies and gentlemen, I stand before you today to speak on free healthcare, which should be a human right, not just for those who can afford it. The human race has spent countless decades learning how to do amazing things, like splitting atoms and putting a person in space. Yet, we're still asking if healthcare is a privilege or a right. There are many positives to universal healthcare, but there are also negatives that may not seem as important unless they happen. In the United States alone, over 30 million people don't have access to free healthcare. Many millions more don't have enough coverage for their healthcare. Many living paycheck to paycheck who don't have enough money or time to go to the doctor for something as simple as a checkup. In more extreme cases, care is delayed, and by the time it's bad enough, they have no other choice. It will cost hundreds of thousands more to help. Over time, medical debt has become the leading cause of personal bankruptcy. According to an article titled, "Is Healthcare in the United States a Right or a Privilege?" 6.7% of people over 18 were not capable of accessing medical care because of the price. That's 6.7% too much. Not everyone is born with perfect health. Over time, that already poor health will only get worse. In a book titled "One Nation Uninsured" by Paul Starr, the author writes, "The uninsured are not just numbers. They are casualties of a system that has chosen private power over public responsibility." Free healthcare saves so many more lives. Just because someone has money doesn't mean that they will have a better outcome on their life after a medical emergency. Well, in the US, that's exactly what it means. In a book called "The Healthcare Fix" by Lawrence J. Kotlikoff, the author speaks about how the current ways in America are unaffordable, inefficient, and unjust. Having a change where everyone gets coverage will allow for more affordable care, where people won't have to worry about where they're going to get the money for an emergency surgery after spending all of their money on the room they're staying in. Another book titled "Universal Healthcare" by Pat and Hugh Armstrong is about how healthcare systems are a reflection of our values, systems that are built on equality to have a far healthier population. The negatives of free healthcare are limited, but not non-existent. Though some may think free healthcare is 100% positive, it can be abused, and it can make healthcare organizations have longer wait times. People are being exploited by fraudulent workers for no apparent reason. A universal healthcare system would require increased taxes to help fund it, as well as increasing the national debt in America. Another negative of free healthcare is longer wait times for doctor's appointments and room openings. People have had to wait for non-emergency procedures for up to multiple weeks because of less space for people to be in rooms and a lack of needed resources. It could also put a strain on healthcare providers because of the misuse of services. It can increase the strain on the healthcare infrastructure. If healthcare were to be free, people who had little to no coverage would immediately go to the doctor, and the care for others would be put on hold. This would severely overwhelm all aspects of healthcare, leading to an overload of work, which means less time to effectively help people. Imagine a country where parents don't have to worry about whether their children are going to get the care they need, where anybody can see the doctor before it becomes so bad that there's no way to fix anything, where just because you live in a certain place doesn't mean you won't be able to even try to get better. We can't get to a place like that without the help of everyone in the world. Healthcare isn't some reward for good behavior. It's a right. It's something that should automatically be given to every person on the planet. It's for everyone, no matter their way of life. No matter how much money someone makes a year, we need to start saying we can't afford not to have our health coverage rather than debating if we can have it at all. Thank you.